Hey, good morning. It's Nicole Clark with Health Pro Heritage's QA and compliance team. I am with you here today for another The Right Way Wednesday. And today I really want to talk to you about students and specifically the student's role when providing group and concurrent therapy. Now, if you have a student, you know how important it is that you not only teach that student how to connect with the residents and how to provide clinically sound judgment, but also then ultimately how to document and then bill for those services that they're going to be providing. And that really starts with understanding the parameters that surround their billing document and treatment of patients as their students. So I wanted to go over a couple of points and talk specifically about the differences between Part A and Part B. So if you have a student working with Medicare Part B residents, you have to understand that they have some specific restrictions. And what they say is that the qualified practitioner, so that is a therapist or therapy assistant, really has to direct the service, okay? They are required to make the skill judgment, and they are ultimately responsible for then the assessment and the treatment of that resident. And so that means we need to require that the therapist or therapy assistant, not the student, actually provide the treatment and then document and bill for that treatment. And the student can be present, so they can assist in that treatment, but they can't direct the treatment. So they really just truly have to be an assistant to the therapist or therapy assistant in those cases. Okay. Medicare Part A is a little bit different. They do have the ability to treat residents who have Medicare Part A. And what Medicare Part A says is it's really up to the judgment of the supervisor or the state practice acts, and that whichever one is more stringent. And that is a very clear distinction. They want to make sure that you understand and refer back to your state practice act because they could have some very specific guidelines around students providing treatment to patients. So you want to follow that carefully. The supervising clinical instructor and student are actually considered a billing entity or a single unit. So they are one person. So that means the student cannot hold a caseload that is separate from the supervising clinician. So they are to work very closely together, and that supervisor really has to be monitoring and supervising that student as the student is directing those skill treatments. Okay, so what does that mean then for group and concurrent therapy? Well, students really are bound by the same guidelines that clinicians do when talking about the requirements for group and concurrent therapy. Okay, so you want to understand those. But when it comes to then groups and Part B residents, because of those restrictions that I just talked about, students are not permitted to treat patients with Medicare Part B. So any groups that they are involved in not just the planning of, but the actual execution of. So if they are actually leading that group treatment, that group treatment has to consist of residents who have Medicare Part A. If you have a resident that has Medicare Part B, the therapist or clinician then must lead that treatment. Again, based on those parameters that we just talked about. Now, what about Medicare Advantage plans? You have to consider those very carefully. If you have a student and you have patients who have Medicare Advantage plans that you think would benefit from a group treatment session or even concurrent therapy, you need to make sure you really understand the parameters not only surrounding the ability to have that patient participate in the group or concurrent therapy at all, but then whether or not a student is allowed to lead that treatment. So it's very important that you just follow whatever individual Medicare Advantage plan that they have. All right, if you're a Health Pro Heritage employee, we do have some policies and procedures that really outline the role of the clinician with student supervision. So it's really important that you go and look at those. I'm sure if you've had a student already, you've already read those, but if you're interested in taking on a student, learn about what your responsibilities are. And those are policy and procedure number 264, and then 264A and B go along with that. And so it's really important that you read through those and understand them. And if you are not a Health Pro Heritage employee, check with your company and see what their guidelines and restrictions are, and then make sure that you understand then the payer source parameters that are in line with that. All right, as always, feel free to ask questions in the chat box below. We would love to help you with any of your challenges in regards to students or anything else, documentation or even appeal and denial related. Thanks so much for your time, and happy documenting.